I'm Dr. Nabeel A Q Jr, Consultant Pediatric Surgeon from the Department of Pediatric Surgery at Narayana Health City. Today I have with us Dr. M Zameer, Senior Consultant Pediatric Surgeon and Robotic Surgeon from the Department of Pediatric Surgery, Narayana Health City. We, Indian Association of Pediatric Surgeons, celebrate our Pediatric Surgery Week every year. This year, our theme is childhood safety. What is childhood safety?
Well, child safety refers to safety of children in our surroundings. So we are talking about protecting our children from accidents that happen at home as well as outside. So with this theme, this week we want to spread the awareness among all the caregivers, parents and others and the society about the dangers that children have and how we can prevent them.
Dr. Zameer, how big is the problem in India and worldwide?
Well, child safety is an issue whose magnitude has been underestimated in the society. If you look at the statistics, accidents in children is the leading cause of death in America. Almost 7 lakh deaths happen every year to children because of these accidents, which means almost 2,000 deaths every day. And these deaths are primarily because of drowning, because of burns, because of choking and road traffic accidents. And almost 75 to 90% of all these accidents are easily preventable. So by this, we want to say that we can reduce this significant fatality that a society has by simple measures.
That's a big number, I must say. I would like to know, why are children more vulnerable?
We see children are very inquisitive. They love to explore things by touching them, feeling them, tasting them. That's the reason even toddlers, you see, they put anything that comes in their hand in their mouth, and sometimes this can lead to serious problems. Also, children are easily distractible. This leads to accidents more often in children than adults. And we, the parents, caregivers and the society, it is our responsibility to make sure that children are safe. So that's the reason why it is our duty to make sure we protect them in all kinds of surroundings.
I think you have summed it up pretty well. But if you could, give the viewers a bit of insights on what are the more common yet serious problems we come across.
If you see, the most serious problems occur in very common surroundings. We as pediatric surgeons come across accidents like burns that happen at households, especially in the kitchens where hot liquids like hot boiling water falls over the children. We come across electrical accidents where children are exposed to electrical appliances, they put in their fingers in the plug points. We come across choking, which is a very serious problem that happens in children. This happens when they swallow small solid objects like peanuts or button batteries or even coins. Drowning is another important aspect which we need to look into, because we cannot leave children unattended in the bathrooms or in the swimming pools. Also, outside the house, we come across road traffic accidents, a lot of accidents that happen in the playgrounds, which can lead to cuts, major injuries, fractures. So these are the points where we need to highlight.
I think you have highlighted them pretty well. Another thing which I would like to know, and I think even our viewers would like to know, is you have mentioned about the common scenarios. But we as adults, what can we do to prevent them?
Well, Dr. Nabeel, if you actually look into each one of these, you'll be surprised that by following simple measures, almost all of them can be prevented. Like, you don't want to allow small children, toddlers in the kitchen. You don't want to handle babies, you don't want to carry babies at one hand and carry a hot cup of tea or coffee at the same time. By this, you prevent major burns and scalds in children. All the sharp instruments in the houses and outside, like scissors, knives, have to be kept out of reach from children. Plug points, as far as possible, should be capped or again kept out of reach. Children should not be left unattended in the bathrooms with buckets of water or outside in the swimming pools. Choking is one thing which we come across, which is a serious problem that because it can lead to respiratory distress. The child chokes on simple food items like peanuts or coins. They're not able to breathe and they have to be treated immediately. So if we keep these small objects, hard objects away from children, don't allow them to play with small detachable toys, major accidents can be prevented.
I think that was a nice and lucid talk, and I think you have explained very well in very simple points of the simple things we can do to avoid this. Now, a final take-home message for our viewers and for the parents out there.
Well, to conclude, I would like to say that a child's life is very precious. It is our duty as the parents, caregivers, and the society to protect them. We must all be aware of all these potential dangers and take simple measures to prevent them. We as adults should act in a way which acts as a role model. We should be role models for safe behavior. And we must remember that prevention is always better.
Thank you all. Thank you so much. I think all the major points have been explained pretty well. I hope this talk has been informative to you as well as to many other people. So please kindly share this message as much as possible. Thank you so much.
Thank you.